welcome back to my channel. I was so ready to be done with this. In the last video, I was like, yes, we're done. But no, we're going to pick up where we left off at documentation. I'm going to start the timer here. Yeah, so we're at standard 5, documentation. Music therapist will document the client referral to music therapy, the assessment, placement, treatment planning, and ongoing process of music therapy, with regulations, of course. Music therapists will periodically document the client's level of functioning in regard to their goals and objectives. No duh. The goals and objectives are the goals and objectives are the saving grace here. The goal, for the most part, is a saving grace because, that's why the client needs therapy to begin with. And then the objective is really how you keep your job. If you stop, if they furlough you, if they, get rid of your position, well, then these objectives aren't going to be met. Therefore, this goal isn't going to be met. You got to use it as leverage. The documentation of process will describe significant intervention techniques and responses from the client. All documentation in music therapy services, the music therapist will write an objective professional style based on observable client responses, include date, signature, professional status, place such documentation in the client's file, and maintain confidentiality. And the goal is, so the goal is the general, I'm going to do a video on this in a little bit more depth, but it's client will walk steadily, that's the goal. And then underneath, client will move to the beat for 30 minutes throughout the session. Client will move to the beat 40 minutes throughout the session. Client will move, so objective is you give it a measurable goal. So it's 30 minutes. They will move to the beat for 30 minutes. Okay, so you could say they will walk to the beat. They will walk with 2 legs to the beat for 30 minutes. Make it a little bit more specific. So because the point of an objective is to show people what you're doing every day with this particular client. So client will sing for 30 minutes. Okay, right? But if somebody who's not a music therapist reads that and they're the one responsible for your position, they're going to be client will sing for 30 minutes. I walked by that door and I didn't hear no singing. So what are you doing with, why are you wasting company money? That's what they're going to say. So that's why you need to be kind of specific, measurable, obtainable, right? So client will sing, client will sing patriotic music for 30 minutes throughout the session. Okay, so then when the person walks by the door, they hear America the Beautiful. Oh, okay, the client is singing patriotic music for about 30 minutes. Okay, that music therapist is doing her job. So see, that's why goals are very important. Well, goals are very important. Objectives are even more important because they can save your job. Obtain written client permission. That's kind of an obvious one. Document referrals. That's another obvious one. And documentation of all referrals, including date, source of referral, service. They don't talk about session planning. That's definitely documentation in and of itself, but whatever. Stop talking about termination. We don't do termination. It's the facility, it's the client, it's the insurance company. It usually never comes from the music therapist. Music therapists will terminate music therapy services when client has attained stated goals. Usually they never obtain stated goals because there's always something you need to work on. Okay, so they do mention no longer being able to be scheduled. I guess in some regard, if you work at a acute center, you might have to do termination. But when I worked in the emergency room, we did discharge reports. But So when you are going through a termination plan, and it even says here you want to focus on the goals, the individual music therapy treatment. It says to coordinate. That usually never happens. Allow sufficient time for coordination, approval, and future implementation. That also never happens. And summarize the client's progress. So what ends up happening in a real termination is you summarize the client's progress, and you mention the goals, and you mention what you think they can work on in the next facility. Again, usually a termination report is written after the patient already leaves. And usually we don't have a say if the client is terminated from music therapy. Continuing education. It is the responsibility of the music therapist to maintain knowledge of current developments in research, therapy, and techniques in music therapy. A music therapist will familiarize themselves with the federal, state, local laws. That's again an obvious one. Music therapists will contribute to education of others. That's what I'm doing. Okay, supervision. It is the responsibility of the music therapist to seek and participate in supervision on a regular basis. Gee, I wonder, I got a lot to say about this category. Types of supervision may include, but are not limited to, direct observation, peer review, verbal feedback, group supervision, individual supervision, and music-based supervision. I got a lot to say. Why don't I dive in? So, music therapists must seek and participate in supervision on a regular basis. For those of you who do not know, because you were given supervision in school, in practicum, in internship, when you get supervision outside in the real world, you have to pay for it. And girl, like, these people are going to be charging you like 100 plus an hour, you know, like, and that's just the way it is, because these people, they have to travel, they have to miss a day of work, they're working and supervising you. It takes a lot of time. It's really expensive to get somebody to like supervise you, so usually nobody does it. It's not really that great, okay, but usually nobody does it. And similar to like music lessons, you do need music lessons as a music therapist. You do need to go to a therapist as a music therapist. You do need supervision. But everything I just named to you is $500 for every month, okay? And we don't get paid that much when we're entry level, so it just doesn't work that way. What I do for supervision out of all of these is I'll do verbal feedback, peer review. And by peer review, I mean messaging my friends on Facebook, because we have a group chat. That's what I do for supervision. I'm not getting nobody to come in, and I'm not paying I'm sorry, I don't have that kind of money. Pay me more if you want me to get real supervision. Okay. And this was 7, 8 supervision. Okay. 8, 1, 2. Music therapists may seek supervision from music therapists as well as other professionals. Okay, here's the deal. So it talks about, again, I got lots of stuff. People really rub me the wrong way. That's why I have a lot to say about this. So it says that us as music therapists can get, supervision from psychologists, psychiatrists, social workers, art therapists, dance movement therapists, drama therapists, physical therapists, occupational therapists, speech therapists, and physicians and nurses. You cannot get supervision from any of these people. I'm just saying, because they don't know what the heck we do. I just want to also point out that rec therapy isn't on here. Anybody watch my horrible supervisor video, because I had a horrible supervisor who was a rec therapist who thought she could supervise me in music therapy, but she couldn't, because she didn't even know what music therapy was, and that's something to keep in mind. I also worked with an individual who got a DIY, dance movement therapy degree. DIY, like, that's definitely not certified by nobody, and she thought she could supervise me. But no, none of these people can supervise you, okay? They can give you advice on the population. Like, I worked with physicians when I was working in long-term care, and I session planned, and I went to meetings, and sometimes I co-treated. Like, I co-treated with speech pathologists, I co-treated with physical therapists, I connected with physicians, I shadowed physicians, I talked to them about things music therapy wise, so that can all happen, but they cannot supervise you like your practicum internship supervisor did, because usually these people don't know what we do. I'm just putting it out there. So they can't supervise you. And if they do supervise you, they're probably going to talk down to you and make you feel horrible about yourself, because that's what happened to me. It is your responsibility as a music therapist to provide supervision, to maintain current knowledge and development. I feel like this is yelling at me. No, I don't know, anyway, I'm just going to keep going. Providing supervision will be familiar with current federal, state, and local laws and the AMTA Code of Ethics. Music therapists providing supervision are required to adhere to the AMTA standards. Music therapists providing supervision will complete necessary documentation. Music therapists providing supervision will keep all supervision confidential and keep it for at least 5 years. So all of these things that you are supposed to do if you are supervising another music therapist is correct, and people do follow this, okay? But it's just, I don't know. It's very important to get supervision, but no one does it because it's not necessarily feasible in the real world. Now, if I was a doctor and you went to conference, you did research, you wore many hats in the hospital, and you had to go through supervision, and everybody supervised everybody else within the circle, well, then that's a lot more feasible. But in this case, as a music therapist, you do not have other music therapists in the facility with you for the most part. A lot of times you are an independent contractor, so nobody really knows your clients, so it just doesn't really work, okay? Addictive disorders. Oh boy. These standards of clinical practice are designed for music therapists working with clients who have addicted disorders. I did work with a few clients who had addictive disorders. So we're supposed to use music to restore, maintain, and improve mental, physical, and social emotional functioning. So up here, this is kind of the general part that you want to sort of pay attention to within all of these different disorders. Why are we using music therapy with these clients? What's the goal? What's the purpose? That's what you're going to mainly need to know, because when you get a question of, oh, this person is addicted to alcohol, what can we do? You're going to pick the correct answer based on what it says right here. And also, I'll read it one more time. Music therapy with clientele who have addictive disorders is the specialized use of music to restore, maintain, improve mental, physical, and social emotional functioning. So any question that deals with addictive disorders, the best answer is based on that statement alone and a little bit more. So we have referral and acceptance. Let me see if anything is different. Client will be assessed through music therapy services. It looks like this is all the same that we kind of already went through. Okay. So information must be obtained from different disciplines. Test results, final decision is based on the team. When appropriate, results will be communicated to the client. Yeah, that's true. You'll know what clients you can communicate results to, who will get it, and which clients won't. Just based on, personality and, how often you work with them. Assessment for music therapist will make an appropriate referral. Okay, here we go. So this is another important aspect to each discipline. So we have music therapy assessment will include current diagnosis and history will be performed in a manner congruent with the patient's level of functioning in the following areas. So then I'm going to read these out loud, but this is everything. So we have so far And I'm going to use my lovely Planet Fitness pen, so it's in purple. Whatever the disorder is, addictive disorder. So this is like the main purpose of music therapy, and these are all the different things that you can do for the patient based on the exam. I understand you can do a lot more with this type of patient, but based on the exam, this is what you're going to need to know. Emotional status, motor development, developmental level, independent functioning and adaptive needs, sensory perception, attaining behaviors, sensory processing, planning, and task execution, substance use or abuse, vocational status, reality orientation, educational background, coping skills, infection control precautions, medical regimen and possible side effects, mental status, pain tolerance and threshold, spatial and body concepts, long and short-term memory, and then client's use of music. So when I worked with addictive disorders, it was the client had acquired brain injury, and then they either started to have addictive disorders, addicted to substance abuse as a secondary result, or sometimes they were already on track to becoming addicted to substance abuse, yet the acquired brain injury caused the pertaining issue to become worse. So in those particular clients, we often worked on independent functioning level, because most of these individuals were already independent before their acquired brain injury, and if they did have some type of substance use, it was usually okay because they had independent functioning. We also did substance use and abuse, obviously, because with acquired brain injury, sometimes they'd go up and they'd be great and they wouldn't use the substance, and sometimes they'd drop down. That also includes short-term memory. Obviously, client uses music. All of my people love music. So I didn't work on this, but vocation status, that was something that my facility focused on. We have coping skills. That can be kind of difficult if they're acquired brain injury, but it was something that we worked on. And I'm wondering if there was anything else. Motor development, kind of, because they were aging, acquired brain injury, and then emotional status. So this is what I focused on when I worked with addictive disorders. But remember, it was acquired brain injury, and then they usually had addictive disorders that were more prominent because of their injury, or became more prominent after they were already sort of at surface level. Treatment planning. I'm going to see if any of this is different. It looks like it's all the same. Comply with control procedures, incorporate medical precautions, use appropriate musical elements. So all the same as before. So I outlined, again, this paragraph and then this. And then I just starred what, happens in real life, but that's the way it is. Implementation. Let me see if any of this is different. Strive for highest level and quality of musical involvement. Again, we always focus on maintaining. Record and schedule procedures. Disclose information to patient's family with consent of the physician. Yeah, so everybody on the treatment plan, they'll know if you should tell the patient, tell the family. So just talk to your team. Documentation. This should be the same because we're talking about objectives. We're talking about signing and dating. And then, let's see, blah, blah, blah. That's all the same. Termination of services. Again, we had a couple of clients with acquired brain injury, addictive disorders who ran away. I know it's horrible, but that's why they were terminated. So It all states the same exact continuing education. Here it mentions related areas of service, maybe but not limited to the 12-step programs. You could star that. I highly doubt it's going to be on the exam though. We'll just star it because it's different than before. And then supervision, I think, is all the same as well. Yeah. Okay. So moving forward, then I'm just going to highlight because I don't want to read everything all over again, but I'm going to highlight what's important for the discipline, and then we'll focus on, I guess, the treatment plan, and then we'll focus on if anything else is different. If any of you guys want me to go over it in a different manner, I am more than happy to, but this is what I'm going to do for the rest of this video. So next one is consultant. I've never heard of this. Music therapy consultant works in education, psychiatric, medical, and rehabilitation facilities. I wonder if by consultant they mean like a program coordinator. You know how sometimes music therapists get lumped in with that title? We have, let's see, this should actually be all the same, because if you're a music therapist, a program coordinator, you should be doing all the same things. It doesn't look like anything's different from the first part of the video. Yeah, termination, continuing education, supervision. All right, here we go. Intellectual and developmental disabilities. I'm reading the second paragraph. Music therapy with clientele who have risk for developmental disabilities is the specialized use of music to improve and maintain functioning in one or more of the following areas: motor, physiological, social, emotional, sensory, communicative, and cognitive functioning. My internship was in intellectual and developmental disabilities hospital. So, yes, all of the above, that's what we did. We focused, on everything. Motor, physical, social, emotional, sensory. Sensory was a big one. I didn't work on that as much with acquired brain injury or addictive disorders. Communicative and cognitive. Cognitive was kind of difficult. We used a lot of adaptation interventions. So moving on, I'm trying to see if they have anything. Here we go. 2.9, client adaptive functioning and developmental level of the following areas: motor functioning, sensory processing, planning, and task execution, emotional status, coping skills, infection control procedures, attending behaviors, interpersonal relationships. So this is all that we focused on for the most part. And in terms of infection control, a lot of them had compromised immune systems, so we always had to go through infection control procedures. Everybody at the facility did it. Everything else should be the same. Yeah. All right, moving on. I think we'll do educational setting, and then we'll call it a day for this one. So educational setting. This is going to be an interesting one to read. Second paragraph. Music therapy in a publicly funded educational setting for students with disabilities may be defined as the use of music as a medium. Keep that in mind. Use of music as a medium for assisting the students in meeting defined educational goals and objectives. In providing this service, the music therapist works closely with all members of the treatment team. Music therapy and other educational settings may be encompassed in a broad range of therapeutic goals. I interviewed for a position at an educational setting. It was a high school for children with autism. And they focus on using music as a medium for educational goals. So they did music therapy sessions, but most of the goals were like learning how to live, learning how to be in a musical ensemble at times, learning how to do math, And then as a music therapist, you had to do everything. You had to do the math. You had to do the teaching the music. You had to do the socialization. You know what I mean. Moving on. 2.2, blah, blah, blah. This all looks the same as it was before. I'm glad that this is all the same. It makes studying a lot easier. Documentation even looks the same. Okay, and then older adults. That's all we have time for today, and I'm beat. Ugh. I hate studying. No, I actually don't. I like studying this stuff. Like, it's actually easy compared to, like, what I used to do or what I do now in school. It's just I get kind of tired of talking. So, until next time, talk to you guys later. Bye!